Okay, I think that we can start. So thank you so much, everyone, for joining this today webinar. It is really a pleasure for us to welcome this webinar. It is one of a series of webinars that we've organized in the field of the medical device. The today webinar, Health Technology Design for Children with Children, is mainly aimed to focus on the patient involvement in medical device development. As you know, versatility is key to the development of health technology for children and young people. So it is adapted to their social, physical, and developmental needs. Even the best health technologies and medical devices fail simply because they are dismissed or rejected by the end user. So children are open and honest about their healthcare needs. It is important, and what this will be also underlined during this webinar, is that co-design and development of medical devices with children and young people is key to adoption, acceptance, and trust. So the today webinar will be presented by Professor Paul Dimitri. Professor Paul Dimitri is the National Institute for Health Research National Children's Specialty Lead, also director of the NIHR Children and Young People MedTech Cooperative. The second speaker of the webinar will be Dr. Jennifer Preston. She has a full-time position at the University of Liverpool, based at the Alder A Children's Hospital in Liverpool. But I would not waste time to, I would leave the floor to the presenter in order that they can start the webinar. I kindly ask all of you to please take your microphone muted, and at the end of the presentation, we will give the floor to the participant in order that you can write down your question in the chat box, and I will speak loud all the question in order that it can be answered by the speakers. If you have any further question, you can write me also for any technical issue you can encounter. Hopefully not, but any further communication, please use the chat box. So thank you so much, and the floor is yours, Professor Dimitri. Thank you so much.
Maria Angela, thank you very much for inviting me to speak on this, and it's also a great pleasure to be joined by Jennifer Preston, who's one of my long colleagues from many years ago. So Jen and I have known each other for about 15 years, so I'm sure between us we will focus on and tell you about a very important topic that's very close to both of our hearts, which is about health technology design for children with children. And this is really about children and young people being involved right the way across that innovation pipeline to develop technology. And the key here, as you can see from my opening slide, is the word with. We work with children. We do it for them, but we work with them. And part of the challenge that we have is around that technology development for children and young people. And where we start is with these challenges. We have to think about young people in the context of technology development. So it has to be versatile, because children grow and develop, they change anatomically, physiologically, and psychologically. And they're a population, they're not a specialty. We call it pediatric as a health specialty, but this is a population of people with different healthcare conditions. And there's a greater number of rare diseases within those healthcare conditions, which means that the populations are often small, quite diverse, and have very specific needs. And it's because of that that sometimes industry perceive pediatrics or child health is not a commercially viable option, but actually it is. About 20% of the population across Europe is under the age of 18, and certainly in the UK, 25% of our population is under the age of 18. And with the work that we do, we need to ensure that we address adoption and spread, that we don't keep things in one place, but we spread this around the country and across different countries. And there's also that issue about transferability, where initially when we work with children and young people and their families, we're thinking about how a technology fits within the family context, so more about parents using it, but then that transferability through transition from parents using it to young people using it. And then finally thinking about how young people will use this across their lifetime, that they go from birth to 18 years. There's so many different changes, so we need to think about how we prevent them from moving away from those technologies. And there is a lack of targeted health technology for children at the moment. It's currently fragmented and localized, and certainly through IPTRI, we are looking at how we spread our network across Europe to support health technology development and device development for children and young people, and to avoid that repurposing of adult technologies, taking things that are adult and making them smaller, and often with quite suboptimal results, and sometimes with complications. And we also have to change the research infrastructure. Technology development moves quickly, and research doesn't. Research often takes a long time. So we need to think about how we align research with the needs of young people and how we apply new methodologies to technology evaluation. And many of these problems we started to address back in 2014, where we launched a network called the TICH Network, which stands for Technology Innovation Transforming Child Health. And the TICH network was set up to support the specific development of technology for children and young people. And how we started with the network was working across a number of different hospitals in England, working together to form collaborations that would support, first of all, the identification of unmet needs, then to start to think about working with funders to support the funding of those projects, and finally to support spread of those technologies once they were developed. And once we had established a network of stakeholders, we worked with children and young people and those stakeholders to try and understand where those unmet needs were. And those unmet needs are quite diverse. And what's interesting, when you bring stakeholders and professionals together with young people, you start to realize that the needs of clinicians and other healthcare professionals are quite different to the needs of children and young people. And children and young people, much of what we found when we looked at their needs was about fitting in, about, I don't like to use the word normal, but they wanted to feel normal, like their friends. So, you know, simple things about the way they dressed, not wanting their healthcare to be exposed to other young people that would make them look different. So those needs differ often with clinician needs, where the needs are more about how do we investigate, how do we diagnose, how do we deliver healthcare. And so through our workshops, which did include children and young people, and you can see some lovely pictures there from our workshops, what we found was that we found over 100 unmet needs, and we started to classify those. And actually, when we brought in the needs of young people, their families, and the clinicians, we came across two areas that were really important. One was about self-care, and the other was about independence. And that led us to work with a group that's supported by NHS England called the Small Business Research Initiative, or SBRI Healthcare. And this was a funding call that went out specifically that in its entirety supported £4.2 million of funding, so about €4.5 million of funding for two areas. One was about remote monitoring, and the other was about self-care and independence. And this was one of 5 projects that was funded overall. So we had 9 in the first phase where these companies developed prototypes, and then 5 in the second phase. And in the second phase, these companies can apply for up to £1 million of funding to develop these technologies. So this is the Open Bionics arm. This was a company in Bristol, in the west of England, and they've worked with Disney to develop this lightweight prototype multifunctional arm that has actually led, through working with children and young people, to a clinic that now is supported by Bristol and elsewhere for a specific prosthetic clinic that incorporates the services and the technology that allows these young people more independence and more flexibility. And actually, it was through the TICH network that within 3 years, so from 2014 to 17, we had leveraged over £6 million of funding specifically for child health technology. And one of the challenges with being successful is it becomes challenging because your workload becomes greater and greater. And we realized that we needed specific funding to grow. And so we applied to the National Institute of Health Research, which is our research body within the UK, to become one of the medtech and in vitro diagnostic cooperatives, or MICs. And these are set up to develop and evaluate new medical technologies and in vitro diagnostic tests. And we were successful in funding, and we formed the NIHR Children and Young People MedTech Cooperative with the specific scope of offering support for children and young people devices and medical technology. And this is the support we offer as NIHR MedTech. We identify unmet needs. We have a network of leading clinicians. And there, which is important to this talk, we always have input from children and young people and their families. We access healthcare infrastructure. We facilitate collaborations. We have good project management support. We have a test bed in which we can evaluate technologies. We work to secure funding. We support clinical evaluation alongside regulatory and IP guidance. And we have a consortium of leading NHS trusts that we host. We host NIHR MedTech in Sheffield, but there are 6 other NHS trusts around the country that work in that consortium. And I'm very fortunate to have a great team of people working with me in supporting our work. And this just gives you an idea of our work over 3 years. So we've spoken at 57 different conferences. We've published 75 newsletters and 18 peer-reviewed papers. We have nearly 3,000 Twitter followers. But actually, in terms of the work that we do, we have 173 projects that we work on. We have had 76 collaboration requests, and we've worked with 123 small companies and 43 global companies. And so through that work, we've leveraged an additional £9.83 million worth of funding, specifically again for child health technology. And this slide that is probably sums up where our ethos lies, which is that we develop health technology for children, with children. And that's why I chose the title of my talk. And there are 3 components that put the patient and the family at the center of what we do. We work with industry, through health and academia, but each of those actors within that network has their own currency and their own needs. But fundamentally, all of them, we ask to put the patient and family at the center of what they do. And actually, because of that, we work with patients and families right the way through the innovation pipeline. So from the early technology developments, right the way through to unmet needs in child health. And actually, it's the patients and families, as well as our healthcare or service deliverers, those that are, so the service users and service providers, that provide us with those unmet needs. And as those technologies develop through the innovation pipeline, through proof of concept to prototype, then clinical evaluation, that we work with patients and their families right the way through that. And the technology that we work on is quite wide and diverse. So you can see there digital platforms, machine learning, virtual reality and augmented reality, assistive technologies, and so on and so forth. So lots of different areas that we invite children and young people to work with us. So here's an example, because I think examples really help us to understand the value of working with children and young people. So this is an example of non-invasive ventilation. So these are masks that children wear at home at night that provide them with the air that they need through pressure to keep their lungs open. So these are children with significant muscle disorders. And without this, their lungs would collapse at night. Now, the way the masks were originally made was actually through repurposing of adult masks. So the adult mask is fairly big. What the companies did was made them smaller. And the problem with that was that the anatomy of a child's face is different to the anatomy of an adult face. A child's face is much more round, and an adult face is much more oval. So that creates a problem. It creates a problem that the mask doesn't fit properly. And at night, when that happens, the machine alarms. And what parents said to us is that the children, the alarm would wake it up because they could not have, couldn't get a proper seal. So the machine would alarm. What the parents then did was that they tightened the mask to get a good seal, which works. But the problem then, and this is where the children had the biggest problem, was that this creates facial deformity. And actually, the nose doesn't develop properly. They get quite significant scarring on their face. And so what one of my colleagues in Sheffield Children's Hospital did was work with these children and their families and industry and academic partners to develop this project that makes bespoke masks through 3D printing. And it's quite simply that they develop a 3D topographic map from facial scanning, and then they create a prototype mask, digital prototype mask, that then becomes 3D printed. So you get a mask that fits exactly on the child's face. But then the beauty of this is once that child grows and the face changes, you can dispose of that mask and then get another mask in its place. What this exemplifies is the value of working with families and their children to identify problems that can lead to new solutions. This is a video of another example of an area where we discovered through working with physiotherapists that deliver upper limb rehabilitation, and also with young people, that they did not like the way the physiotherapy was delivered. They found it quite dull and not very interesting, and they found it very difficult because it was painful. And what we developed was virtual reality rehabilitation, using exactly the same movements that a physiotherapist would use traditionally, but in a VR setup. And here is a young person talking about their experience. So I hope you can hear the sound to this.
Most of our kids have quite a long-term condition that they need to carry on doing their exercises for sometimes several years.
And then keep that one held, so tight grip on the line.
Yeah. And they're doing the same things day in, day out. It gets really boring. No one wants to do it. Sometimes it's painful. It's just not really fun. They want to be out playing and doing things with their friends.
It's kind of a bit more playing than exercising, even though you are still doing your exercises. Like, it's fun as well. Oh, gosh.
Do you need a break or anything like that? Is your arm tired or?
No, it's fine.
She didn't find it easy, whereas before she would have given things up very easily, but she wanted to keep going. She wanted to pop another balloon.
Yes,
So I'll just move it on there, and just to show you what she is looking at, which I think is really important, because you see her, and clearly this is an exciting way to deliver rehabilitation for children with upper limb injuries or deformities. This is what she's actually looking at on the screen. So this is the virtual reality program, but in 2 dimensions. So we use the bow and arrow for the children to reach behind their back and pull the arrows out and pull them back. And then they start climbing a tower. So this is a movement that they use with their fingers and hands to pull themselves up. And it is physically hard work to do this, even in a virtual reality environment. So they move through this virtual reality environment in different levels to help them get to different parts of the tower. Now, the important part to this, and really fundamental, is that right the way through the process of developing this program, we worked with children and young people to design it. So they told us what they wanted, and this went through an iterative process of development to develop this particular program. So again, fundamentally involving children and young people right the way through the project. And this is another project that we're working on. This is a project working with a company called DigiBeat, who develop digital educational resources for type 1 diabetes for patients and their families. We're developing a chatbot, or otherwise known as a virtual assistant, to support young people as they move through pediatric to adult care through that transitional process. And the chatbot will be developed through a process of co-design, product development, and then further co-design and product development with children and young people. And we have a psychologist, we have someone that's experienced in child health development, working with those young people in focus groups to develop this chatbot. We've already done some of the chatbot architecture and the narrative that goes with that chatbot, and it's been very interesting to see how this is developed, because the way I would have developed it is not the way young people want it developed. And so again, another example of where what young people want is not always what we want as clinicians. And so it's so important to get them involved at a very early stage. Now I'm just going to move on to another area that's really important to consider at the moment, which is the digital divide. And the digital divide, it really describes the access to digital software and hardware and technology, because we assume that everybody has equitable access, and they clearly don't. And this is really important to think about children and young people in the context of poverty. So just when you look at the figures from UNESCO, 55% of households globally have an internet connection. So that's just only half of the global population. And you can see that on this map, which parts of the world have this access. And when you get to poorer countries, the actual access drops to 20% or below. And this highlights the inequality. And even where we live in the UK, if you look at the UK, which is towards the top of the map there, you can see in the northern part of there, which is where I'm from in Scotland, actually there is a digital divide. Some places in the north of Scotland do not have access to good networks or technology. And so when you start to overlap the internet connections with the population, so if you look at the blue dots on the map, those are the people that have no internet whatsoever. So, you know, and actually, this is not just in countries where you might expect that. You can see there are places across Europe as well that don't have access to the technology. So we need to consider the challenges of what young people and their families have when we develop medical devices and technology. And this is going to be key as we move forward, because if we only involve the people that we want to involve in technology development because they're knowledgeable in that field, we are going to create a two-tier system. And actually, this two-tier system doesn't just exist in terms of children and young people and adults. Actually, also, there is a gender divide here, and that may be not so dominant in Northern Europe or in Europe, but it would certainly in other parts of the world. So globally, women are 23% less likely to have internet access than men. And if you go to countries, even when they have, some countries where they even have high internet penetration, to take an example, Iraq, 98% of the men in Iraq can connect to the internet. Only 53% of women can connect. So again, we have to think about that gender divide, and that gender divide filters down to what happens with children and young people as well. That gender divide exists there as well. And we move through to the pandemic now, and the pandemic has exposed that digital divide. And this is work from researchers Hannah Holmes and Gemma Burgess from the University of Cambridge. And this is two statements which I think really state the problem that we're seeing now with the digital divide as we have moved much more to a digital dependent society. The coronavirus lockdown risks turning the problem of digital exclusion into a catastrophe of lost education and opportunity for the UK's poorest and most vulnerable. And so what has happened here is that as we've used the digital platforms and devices to deliver education, it's exposed that divide further. And we are going to see this if we don't think about it within healthcare as well. And I think the second statement demonstrates the impact that poverty can have on families in terms of widening that divide further. They're not on internet banking at all. If their building society decides to close for the coronavirus, they'll have no money. And I think it exemplifies that there are lots of aspects of life, both in children, young people, but their families as well, that create that digital divide. And some of this is about poverty. It's about being able to afford access. It's not just about having a device, it's having access to the internet. It's about having the money to keep that data flow going. And there are other things to think about as well in terms of user views. So we did some work a few years back with the University of York and partners in what we call the White Rose Consortium, which is in Yorkshire in the north of England. And this is published in the Archives of Disease in Childhood. And I would encourage you to read this, because what it demonstrates is that just because we think young people like technology, it doesn't mean that all young people will accept technology within their healthcare. And this was a retrospective scoping reviews on identifying anxieties and issues with young people using technology in healthcare. Part of this was around trust in technology, that the young people wanted to ensure that the technology had been developed with them, with young people, but also with clinicians as well. There was also something about reliability, and there is a plethora of options for different technologies. And this is going back to this issue of fragmentation, that if we develop technologies in small areas and we multiply that over, that children have too many options for them and they're not sure which option to choose from. So working in collaboration or working in networks helps us to ensure that we don't duplicate technologies and we spread technologies effectively. And again, I go back to that ambition or aspiration of the ICT Network, which is to support collaboration across Europe in child health technology development. There's also an issue about data usage and third-party information, and we give away information on a daily basis. When you click accept, when you accept cookies, you give away your data really easily. And in fact, children and young people are concerned when they use health technology that that is exactly what they're doing, and they're also worried about the safety and confidentiality that comes with that. Who has access to their data and who shares that data? There's also a challenge with quality, that technology is usable and developmentally appropriate. And herein lies the challenge that I alluded to right at the beginning, which is young people want to know that the technology is developmentally appropriate for them. And when we're dealing with a wide age range, that becomes quite a challenge. And then there's the aspect of training, and it's making sure that we have that wraparound support for young people and their families to train them on these devices, that we don't give them a device or a digital platform and expect that they will understand how to use it. So this comes towards the end of my talk, and there is no doubt in my mind, and I hope now in yours, that involving children and young people makes the world of difference, that their input right the way through technology development to the point at which something reaches the market and becomes integrated in a healthcare setting is invaluable, that it could make the difference between a technology succeeding or failing because of their input early on. And just as a final note, many of you who are on the call may already be aware of this, but we host the Child Health Technology Conference. We held the first one this year in 2021. It was a huge success. We had nearly 240 delegates and representation from delegates from over 16 different countries, and that was worldwide as well. And the CHD 2022 conference is now open for registration and will be happening next year in May. And if you want to contact me or colleagues from my team, that's the web address for NIHR Children and Young People MedTech Cooperative, our Twitter handle, and our email contact at the bottom there. Ladies and gentlemen, thank you very much for your attention, and I'm going to pass over now to Jen Preston for her presentation.
Thanks, Paul. Just wait for Mariangela to pass over controls.
Yes, you should be able now to share your screen, Jennifer. Thank you. You are the presenter.
No. Not allowing me, Mariangela.
Try again.
No.
Okay, no problem. I will share your slide.
So thank you, everyone. Thank you, Mariangela. And just to clarify, I'm not a doctor yet. I'm currently working on that. So I'm senior patient and public involvement manager at the University of Liverpool. I recognise a few names on the call. So hello, everybody. It's always a hard act to follow Paul because he's got such brilliant slides, but I'll do my best. So just to give you some context, I've been working with children and young people and families in the design and conduct of clinical trials and health technology for the last 16 years. I'm working on a PhD as we speak to explore what does meaningful involvement look like to children and young people. And so some of that work will filter through to SIP MedTech, which is some of the work that I'm doing with Paul and his team. So I'm going to talk to you a bit today. I might focus on some of the issues that Paul's mentioned, but hopefully I won't duplicate too much. So next slide, please, Mariangela. So I always like to start these talks with just posing this question to you. So if you were a business developing a new soft drink, would you bring the product to market without consulting your target audience? And hopefully the answer is no. So next slide, please. So should it be any different when designing sorry, that's duplicated there. So when designing health technology for children and young people? And again, hopefully, I think the answer should be no. So next slide, please. So in my world, we call this patient and public involvement. And so what that means is it's the active partnership between patients and the public and researchers in the research process, rather than the use of people as subjects of research. And Paul's touched heavily on that in his slides. So next slide. So in the world of health technology, this is also known as user-centered design. However, some of the same principles apply. And again, Paul's touched on most of this, but it's just basically to encourage children and family involvement right from the start. So to really understand, truly understand their needs, to right the way through to developing a prototype and then testing that prototype until it's fit for purpose. So next slide. So I think the benefits of listening to children is obvious, and if it's done properly, this leads to improved functionality, quality, usability, acceptability of technology for children and families. And again, Paul's already touched on those. So next slide. But from our perspective within SIP MedTech, and my role is to lead on and inform and support our researchers, so our theme leads who deliver on patient and public involvement, is to make sure that we're coming from a child rights based approach to children's involvement. So it's not just a good thing to do. It's not just, you know, that we should be listening to young people. It's actually a child's right to be involved and have their voices heard. And that's quite an important point. It's not just about them being involved, and they have to be listened to. So that's a really, you know, important consideration that we should all bear in mind. So, and this is laid out in the UN Convention of the Rights of the Child, in particular General Comment number 25 on children's rights in relation to the digital environment. So it'd be worth a read if anyone's working in this field, which I'm assuming you all are. So next slide, please. So what this means, so a child rights based approach to involving children in health design technology requires incorporating the following principles of provision, protection and participation. And I'll briefly go into some of these slightly in a minute. So in terms of provision, what we mean is access. We should give children and young people access to age-appropriate, safe and effective medical devices, healthcare technologies and technology-dependent interventions in the NHS and obviously wider. We must protect our children from harm, and again, Paul's touched on that in terms of data protection issues and trust issues that our young people are telling us that they have. But we also must provide clear, accessible information and guidance for young people to navigate the environment. And again, Paul's touched on that in his presentation. But my job, my whole focus of my work, including my PhD, is about participation and is how do we involve children and families meaningfully in everything that we do. So next slide, please. So I'm going to touch on some of these in a little bit more detail, just to pull out some of the findings from a young person's survey that was carried out in 2009, which surveyed over 1,500 young people. So next slide. So in terms of, 92% of the young people who were surveyed, they all believe that technology is a critical enabler of healthcare and healthcare solutions, and 62% of those said that they already use technology for their own health needs. Now again, going back to what Paul was saying, we have a captive audience here, but only to those who have access to this technology and you know, these devices, and such a huge divide. Next slide. So investment in child technology and child health technology is needed, and young people agree that this is a requirement and it's critical for all young people to access technology to improve their health. And it's a big concern for you know, different groups of young people, especially girls, as Paul alluded to. Next slide. And again, what Paul's already mentioned, despite young people's openness to technology to improve their health, there are challenges and concerns, and young people are particularly worried about sharing their data and data security, and also about false information that they receive through social media and so on. So protection is really important, a point that we should all be aware of. Next slide. So the young people want to know about who uses the data, you know, what is it used for, how they keep it safe, and how long did they keep it, and everything that is collected of theirs needs to be, you know, managed safely and properly. So they also want to know how people get their information, which I think is a really big issue for anybody, not just young people. Next slide, please. I think the biggest issue that our young people face is the issue of trust, and who can they trust. And as you can see from these statistics, you know, I think the likes of government, the media, big tech companies need to develop strategies really to communicate out to children and young people and build their trust when it comes to what are they doing with their data. So you know, I don't think many people do trust the likes of the governments or, you know, tech companies. So they've got a lot of work to do. So next slide, please. So one way to do this, to build the trust, to give information, to you know, promote technology development in children and young people, is through listening to the voices of children and young people, and more importantly, have their views and concerns taken seriously. So next slide, please. So participation, however, has to have a purpose. It has to lead to an outcome or change that is relevant to children and young people's lives, not the lives of researchers or those who are developing the technologies. So it's really important that this is right, and it's developed for children, not necessarily just to tick a box to say that you've undertaken patient and public involvement. So next slide, please. And it's this approach that we bring into CHD Medtech's patient and public involvement strategy, as again Paul's spoken about. But so our strategy is about working in partnership with children and families at every stage to continue to improve our young people's experiences when they take part in research or in the development of technology, to widen that participation so that we get a wide variety of children and young people's voices coming through to develop those technologies with us. And importantly, I suppose from my point of view, doing my PhD is about looking at growing the evidence base about the impact of children and young people's involvement in the design of health and health technologies. Next slide, please. You can find out more about our patient and public involvement strategy on the website, and more importantly, to sign up to our newsletter, which showcases case studies of all of our patient and public involvement activities with children and young people. But it's a good way to keep up to date with all the technology developments that Paul and his team are leading on. Next slide. So for those who know me, my role for the last 16 years has been trying to create meaningful models to involve children and young people. And one model that's been really successful and is now globally renowned is the Young Persons Advisory Group that we set up in Liverpool in 2006 to inform the design and conduct of clinical trials and health technologies. And that's grown from strength to strength, and some of my colleagues are on the call. linked to the European Young Persons Advisory Group Network that I'm a founder of with Begonia and friends, and our colleagues across the globe through the International Children's Advisory Network. So the Young Persons Advisory Group is just one model to involve children and young people. There are many models, but it's been a great success for us to tap into, and they're a fantastic group of young people, or groups of young people across the globe, really dedicated to changing the lives of children and young people. So next slide, please. But another part of my role is also to co-produce research with children and young people, and a huge part of my PhD is about developing young people as peer researchers so that they get involved in the whole of the study design of my PhD, because I want to practice what I preach. But this project, again, is being led by Barcelona, and my colleague Begonia, who's on the call, is looking at developing education resources, so capacity building for children, to teach them about clinical trials. So that was our first series of the toolkit. But this section of the toolkit is about medical devices. So it has several modules, but most importantly, it's being co-created by children and young people, 4 from the Liverpool Young Persons Advisory Group and 4 from the Barcelona team. And as Begonia would testify, it's been a steep learning curve, because we got funding for this and we had great plans to go to Barcelona, Berlin, Paris with our young people to develop these modules, but unfortunately COVID struck and we had to go all online. But luckily that photograph in the middle is our young people meeting together in Liverpool just before COVID struck. So next slide, please. So just to say that that toolkit will be launched next week. The registration details, the link to the registration details are there. It would be great for you to join that call and to find out how you can be involved in pilots and some of the educational tools that are within that toolkit early next year. And please get in touch with us if you would like to get involved in the pilots, because we do want other young people and other people working with children and young people to look at those tools and evaluate them for us before we launch them officially. So next slide. So just to say thank you everyone for listening to my talk. I hope it was helpful. Here's my contact details, and over to any questions.
So Jen, I don't know if Mariangela is going to come in here, but I've got a lot of questions because I love listening to you talk. So, I'm returning the compliment, because you always make me think about a number of different things around involving children and young people. And I guess a comment first, which is, one of the, I've talked and you've talked about the value of working with children and young people, but I don't think you ever understand it until you experience it firsthand. And, I've sat on national committees that fund quite significant sums of money, and I've invited children and young people to those, and they're always the ones with the killer question. They're always the ones that I sit there and I think, oh, I wish I'd asked that question. And it's always the young people, because they see things in a different way. They see things through very unbiased eyes, and they see things very practically as well. And I think it's fair to say, as you get older and you get more entrenched in healthcare, that you become more biased. And so having that fresh outlook is so important with those young people. It's a question really, Jen, and it's probably something we could discuss both on and offline, but it's really about this issue of the digital divide. And I think COVID has really blown this one open as an issue. And good and bad things come from COVID. And actually, I think exposing it has been a good thing, because I think it's been an issue in research for many years. I think that divide it spreads beyond the digital divide. I think there's been an inequity in research for many, many years that we've kind of known about, but sort of shoved to one side because it's difficult to address. Now we have to address it because of the delivering digital technologies and also digital research. I've talked about money, but from your perspective, from what you've done so far, what are the other factors that create that digital divide? What have you seen that has created that gap there that seems to be widening more and more?
think some of it is also about education. And I think the biggest issue that we have in the world of patient involvement is having that representative view, not just of a few select young people. And it's so difficult, but then that's widened as well even further because of COVID, because everything's had to go online. And if those people haven't got access to digital technologies, you know, or the internet, something basic, or, you know, there's one family that we work with who've got 4 young people, and so there isn't 4 laptops in a household. They'd be lucky to have 1, or, and so the issues of trying to communicate to them individually is a big problem. So I think it's accessibility of such, I mean, we've seen, like you say, we've seen it in schools where young people didn't even have a laptop at home, or they were relying on their parents' laptops and so on. So I don't think there's any easy answers, in all honesty, Paul. And I think hopefully from COVID, it might wake up a few people to say, actually, this is a big need and we need to tackle it head on. And
one of the things you've spoken about, and you know, I'm still getting my head around this, is this issue of digital rights, what digital rights actually means. Can you sort of, because I think it would help the audience as well, because you know, I think it's a new concept of what your digital rights are, both, you know, and I think we struggle with it as adults, because, you know, we give away our data so easily without really understanding what our right is to holding data. And, you know, so clicking that, you know, terms and conditions, we throw away data. Cookies, we throw away data. What, for young people, what is it? How would you explain digital rights to them?
So for me, I think, so again, it's, so the general comment 25, so that was born from obviously the UN Convention of the Rights of the Child. And so I think obviously coming into the digital age and everything's digital, you know, my 1-year-old grandson is on an iPhone. If he can get hold of one, he will use that iPhone, you know, that type of skill set from a very young age. Well, I think from what I love about the UN Convention and the general comments is that they really put children and young people at the forefront, because they're often overlooked. So what needs young people have will be completely different to what we have. And it's really, if you delve into it quite deep, it is quite scary in terms of, you know, even toys that, so Alexa, for example, the Google platforms of our worlds, where young people know to speak to Alexa, and they're still sharing their data of their likes and their dislikes. And it's really quite scary if you get into the nitty-gritty of children's digital rights. But some of the things are really basic that don't even consider children and young people's you know, issues and what impact it will have on children's lives if you don't consider it from a children's point of view. So I think the general comment, my advice to people, because I'm still on a learning curve myself, is to read that general comment and to really read around, you know, what does that actually mean for a child? I'm developing this, but what does it actually mean for a child to be digitally aware of what's going on? And it's so difficult, because they want the Alexas of this world. They want to get on the iPads and the iPhones and they're pressing all sorts of buttons. But, you know, and I think it's about education. I think that's about teaching our, you know, or informing our parents that we work with, and parents to say, you know, here's some issues that we, you know, that you might have here. But you know, you're right in a sense where we all share our data so freely. It's quite worrying when we're trying to communicate that to young people.
And you raise a good point there, because some of these technologies now, like Alexa, I mean, you know, we've been exploring in different, with a specific technology, how you can integrate Alexa-based technology. And of course, we've got to understand what that Alexa-based technology is, you know, doing at the time where we're integrating it into a medical device. And I think it leads to, there's a question in the chat, if children are concerned about their online confidentiality, how do you reassure them, as they may not have secure Wi-Fi and broadband? That's a really interesting question. And I think I'd start that one off in maybe two different levels. There's the level of the platform and the device itself, and there's the security of the network that they work on. So the security of the network is really difficult to safeguard against, because that's something that happens within the home. But I think what I would say here, and this goes back to your point, Jen, about, you know, why would you do something in a different environment and then not replicate it in the digital environment? And God forbid we ever have garlic Coke. You know, be interested to taste it. But, but it's but you know, we're so hot on safeguarding when it comes to hospital based care and, you know, community based care. So healthcare, you know, in children, safeguarding is paramount. I think what we've got to do as we move forward, and I think this is the clear message, as we deliver or develop and deliver healthcare technology, is to have safeguarding at the forefront of what we do, to make sure that that data is secure, make sure that the accessibility of individuals is limited to those who are trusted, that you would expect in a real world setting, in hospital or in a community-based healthcare setting, and to ensure that the security is such that nobody has access to that data. So I think it goes about, and this is true of medical devices as well as digital platforms, because medical devices will give information in different settings. So my advice there is to think about the digital environment that these young people are working in and compare it to what would happen in the real world, and say, actually, if it wouldn't happen in the real world, it shouldn't happen in a digital environment, and therefore you have to put those restrictions and safeguards in to prevent it happening. Would you add to that, Jen, at all?
No, I think the safeguarding is a big issue, and you know, I think the likes of Google and, you know, and all the social media platforms got a lot to answer to. But I think, like I say, I think young people need to be involved in the discussions as well. So just to, you know, it goes back to the trust issue. It goes back to, you know, working and listening to the children and young people before any of this is designed, because hopefully they would pull up on some of those safeguarding issues as well, right from the beginning.
So there's another question in the chat, and I think it follows on quite nicely from this discussion, which is about, you know, would we develop off-the-grid solutions rather than, you know, do online solutions? And, you know, I don't think it's an either or. I think both are required, and in fact, both. I think the boundaries are blurred there. I don't think it's necessarily that we need off-the-grid solutions instead of you know, Wi-Fi based or network-based solutions, because actually many of the devices that we develop will have some sort of digital integration into a digital platform that delivers or provides data through that platform. I think it's really about the understanding of what happens to that data, and I think the key word, Jen, there is that you've come up with again and again is about trust, which is, and you know, it's interesting to see that the young people, that picture is so telling of the mistrust young people have in tech companies and the trust they have in, you know, those working in education and health. Yet actually the most likely people to safeguard against digital catastrophe are the you know, these are the tech companies, and in fact the clinicians are likely to get it wrong because we don't have the capabilities. So I think it's, and this is where we come from with things like NIHR, MedTech and other networks, is to make sure that we collaborate, that we educate the tech companies, that they educate us, and that we work together to provide those on the grid and off the grid solutions that ensure that children are protected. I think there's a question for you, Jenna. I think we've got about a minute left. So it says, how can YPAGs be better engaged early in the innovation pipeline at the preclinic stage and in our publicly funded labs? So over to you, Jen, because this is definitely your area.
I think we can, it's about approaching the YPAGs and getting us involved, you know, inviting us to be involved. We're more than happy to facilitate early involvement. So it's, you know, please get in touch, because that's what we're there for. You know, we're there to support global international research. So at any stage really, as long as there's a clear output for, you know, our young people and also the young people who get involved in the design. So so yeah, please get in touch. We can facilitate those conversations.
Yeah, and I think, I mean, I'd just add to that, you know, the young people are remarkably receptive to working with you, and actually getting them involved early. I would say it's fair to say young people prefer that, because I think most people don't like to come in late into development, and actually one of the problems with doing that. If you bring young people in very late, they'll tell you what they don't like, and actually trying to reverse engineer something is really, really difficult. Actually getting them involved early on in the process means that you don't have that challenge of reverse engineering a process to get it right for young people. So I wouldn't just say it's about encouraging them. I just get on and do it, because that's really how health tech is going to be successful in the future for children and young people.
Mm-hmm.
And I think we've run out of time, so you and I could sit here and talk.
Yeah.
So I'm going to hand it to Mariangela, I think, to close the meeting. But it's been great presenting with you, Jen. Thank you.
Oh, you're welcome, Paul, as always.
Yeah, thank you so much, Paul and Jennifer, for this very exciting and a very interesting webinar. I would like to remind all the participants that the recording of the webinar, as well as the PDF of the presentation, will be available on the F3 website. And I would really, really thank you for this webinar, and I wish you, especially, and all the participants, a nice Christmas.
Thanks, Mariangela. Happy Christmas,
Bye-bye.
everyone. Bye.
Bye.
Thank you. Bye-bye.